In our society today, obesity is a growing concern, with over 20% of the population now classified as being obese. It can have major implications on people's health, including developing type 2 diabetes and chronic heart disease, both of which are constant links with obesity, and their links to it researched massively. However, over the past few years, the true implications of obesity have been coming to light. In this short video, we will explain one of them to you: obesity linked with Alzheimer's disease. One of the researchers focusing on this is Dr. Gayle Doherty, who works at the University of St Andrews. She is interested in the peripheral metabolism of the brain and looks at different factors that could be used to indicate, and possibly later be used to treat, neurodegenerative diseases.
Leptin is a hormone found within the body that is produced by adipose tissue. Its main function is as a component of a negative feedback system that controls body weight. An increase in weight results in an increase of leptin. The leptin then responds by making the body expend more energy, such as increasing the body's temperature. The opposite occurs if the body loses weight. Resistance to leptin in the hypothalamus is often caused by overexposure to the hormone. It's been linked with obesity and various other conditions. However, it has been shown that regular exercise and a diet designed for fat loss can result in leptin sensitivity being regained.
The world's healthcare is increasingly improving, with cures and treatments for diseases constantly being found. However, this has also brought about several problems. Humans are living longer than before, and with this brings many health complications, including neurodegenerative diseases.
One of these is Alzheimer's disease, which affects 496,000 people in the UK, with 1 in 6 over 80-year-olds being affected. Symptoms include confusion, memory loss, and difficulty with everyday tasks. Researchers think there's no genetic link, but high blood pressure, cholesterol, and diabetes, which increase with obesity, are linked. There's no cure, but some treatments, such as drugs with acetylcholine, can stabilise symptoms.
The abundance of food in the Western world has brought about an increase in obesity levels in the population. It was estimated that in 2010 there were 300 million obese adults in the global population and 42 million overweight children. Dr. Doherty has been looking at these problems and has found a relationship between obesity and the risk of developing a neurodegenerative condition. Increasing age and BMI are linked to a decrease in brain volume but not cognition in the middle-aged. As we have seen, leptin regulates body weight, and there has been a recent evidence into the linkage of leptin with neurodegenerative diseases. Leptin benefits the survival of neurons that can be lost in Alzheimer's disease, and as leptin is less abundant in the older and obese population, leptin therapy could be a possible solution. The research is in early stages, and Dr. Doherty is hoping eventually to help find a treatment for Alzheimer's disease using leptin. However, there are limitations to this. Early prognosis of Alzheimer's is key, and once neurons are lost, they will never be back with their associated memories.
Looking at Dr. Doherty's research, it can be seen that leptin concentrations within the body play a fundamental role in maintaining a healthy body weight, and seem to have a key role within the brain and some of its functions. Further research into leptin may lead to the development of a treatment of neurodegenerative disease, one of these being Alzheimer's disease. Leptin may also be able to be used as an indicator, with increasing levels possibly indicating that a patient may be at a higher risk of Alzheimer's.